Welcome back. Another West Nile season is in full swing. Joining us now is Dr. Timothy Quinn. He practices family medicine in Richland. Thought we could talk a little bit about West Nile virus and how you know if you have West Nile virus.
Well, the good news is West Nile virus, for many that are infected, they don't even have any symptoms. About 80% will fight it off with our immune systems and we'll never even know we had it. But for about 20%, you can get some symptoms. The most common symptoms include a very high fever, you feel tired, you might have muscle aches. So it's a good idea to go ahead and get checked out to make sure that you don't have the serious type of West Nile that usually can last for many years.
So what you're saying is I could have had West Nile virus and not even know.
Oh yeah, like I said, 80% of people that are infected with West Nile, and the way you get infected is you get bit by a mosquito. That's why it's a good idea to try to limit your exposure to mosquitoes. You know, maybe don't go out in the early morning or the late evening when the mosquitoes are out, and try to rid your area of mosquitoes by getting rid of standing water, because that's where the mosquitoes breed. So if you have like water cans or little bird feeders or anything with standing water, pour the water out, because then you can cut down on the mosquitoes and you can prevent getting West Nile virus.
Would the bite itself look any different from a typical mosquito bite?
Not necessarily, because the bite is pretty typical, but the deal is for those, especially those over 50 years old or people who are immunocompromised, meaning their immune system is not as strong because they may have a chronic medical condition, well, that West Nile virus can actually take over and it can multiply, it can get into the brain, and they can get something called encephalitis or meningitis. And in this case, they can get permanent damage to their brain where they can be paralyzed. Some people can lose their ability to walk. And then there's also a lot of short-term and long-term memory damage for those that are affected. So it's something that can be very serious. That's why it's so important, if you have symptoms that suggest you have West Nile, go ahead and get checked out. And then that way, if you need to go into the hospital, they can treat you with the supportive therapy. And in a lot of cases, they can save your life.
That would be, yeah, that's the best case scenario right there. For most of us, we're able to fight it off, but for a small percentage of us, it can really do the long-term devastating effects.
Right. The most important thing to remember is don't ignore. If you're out and you get bit by a mosquito, you start developing symptoms such as the high fever. Some people have severe headache. Maybe they'll wake up. In some of the cases, they've waken up and they can't move their legs. Now, normally, I know it can be pretty serious. It's a very small minority of people that get these serious effects, but the bottom line is they shouldn't be ignored. Normally, it takes about 3 to 14 days, according to the CDC, before you start to develop symptoms. But the most important thing is don't ignore. Go ahead and get checked out. That way, if you need the supportive therapy in a hospital, because some may even have paralysis to their breathing muscles of their diaphragm and have to be put on a ventilator. But the most important thing is do not ignore and try to limit your exposure to mosquitoes. So, you know, it's advised to use the mosquito repellent if you're out, and just be on the lookout and be aware.
Be aware, and they always say mosquito repellent with DEET. Got to have the DEET in there?
Oh, yes, DEET. That's D-E-E-T. And you want to use anywhere from 20 to 30% to really protect you. And, you know, if possible, use the long sleeve shirt and the long pants in the evening, you know, the best you can, because the mosquitoes, those are the culprits of this West Nile virus. So you want to limit the exposure to mosquitoes.
All right, Dr. Timothy Quinn practices family medicine out of Richland. Thanks for the education on West Nile virus.